filled up.
Commendably, the 300-bed isolation center for quarantine and prevention of infectious diseases is one of the centers specified by leading airlines in Nigeria for the clearance of air travelers before they board the plane, which is not far from the fact that its modernized intensive care unit, ICU, administrative blocks, virology and clinical laboratories, 8 consulting rooms, 4 changing rooms, 2 emergency exits and canteens, has 4 wards with 75 beds each, 20 en-suite doctors' quarters, 26 intercom lines in each ward, and 4 disinfection rooms for doctors and nurses. All the beds in the isolation center are linked to oxygen plant, while the entire wards are under close surveillance through CCTV cameras, 2 generating sets of 150 kVA and 200 kVA capacity, among others.
We had to set up a PCR lab here, a virology lab that can take care of COVID-19, not just COVID-19, all other infectious diseases, and will also serve as a research center for this place. So whenever we are equipped and we have the resources to start medical college in Akwa Ibom State University, we'll have a lot of places to be able to train our people, and they will compete with any other place anywhere.
Really impressed by the hospital facilities and things I've seen, and I think we're ready to manage patients almost. There'll be some modifications in terms of setup, but I think the most exciting thing for me personally is just seeing this laboratory and seeing how well it has been kitted, the expertise of the colleagues that are working here already, their deep knowledge of the processes. And I'm not surprised because my team was here a few days ago, a week ago, and they called me and said, DG, this place is good to go without much investment in terms of time and energy. So I'm really happy to be bringing Akwa Ibom into the national network of molecular laboratory capacity, which is really what we're trying to build, not only for COVID. COVID is obviously the most important disease right now, but we want to enable, we want to see every state have a molecular laboratory capacity, and Akwa Ibom has really demonstrated what is possible when there's the political will, the investment in health, and when the leadership of the state is taking the health of their citizens very seriously.
So we're happy to be part of this visit. It's been very enlightening going around to see the isolation facilities, the capacities that are there, the lab capacity, and how the state has used the opportunity of the COVID response to build institutional capacity, not just for responding to this outbreak, but thinking beyond.
There's a difference between how I came in here and how I left. The hospitality here has encouraged me, both physically and psychologically, and it helped me with speedy recovery. So I want to thank the state government of Akwa Ibom State, and the medical team, the Honorable Commissioner, and everybody that worked tirelessly to ensure that today was made possible. Well, a lot of us were discharged.
Wake up from that dream, wake up from that sleep. COVID-19 is real, and we have it. There are people that have been treated and discharged in Akwa Ibom State, and there are still people that are inside here that have not gone yet, that will soon be discharged. So if you are outside, follow the precautions. If they say stay at home and stay safe. If they say wash your hand regularly and stay safe. If they ask you not to touch things anyhow, don't touch things anyhow. Keep social distances so that we can stay safe and live for the future.
In his resolve to provide accessible and quality healthcare services, Governor Emmanuel has built and remodeled health facilities in various local government areas of the state. They include General Hospital Etinan, General Hospital Ikwita Oron, General Hospital Ibiakun Tokokbo, Ikono, General Hospital Ikorokoro, Uruanam, Emmanuel General Hospital Eket, and the General Hospital Ona.
We stand here to commission this secondary healthcare facility that meets every single definition of secondary medical facility anywhere in the world, equipped with modern facilities, modern theater, every single thing, already certified by all relevant bodies across the globe. So today we commissioned this hospital. We know God heals. The medical practitioners, they cure. God heals. Anybody who is here, as we go on treatment, by the power of God, go on the healing. And we commissioned this secondary healthcare facility today in the presence of all the stakeholders, in the name of God the Father, and of the Son, and of the Holy Spirit.
Today, what we are seeing should speak for itself. I shouldn't be the one speaking. If you go around here, and if you have your program, if you check towards the end of the program, you'll see page 16, how the hospital was and how the hospital is today. The medical director tried to mention a few things we have been doing here in terms of the kind of beds we are putting, the wards, the theaters, the emergency and accident units. If you take an aerial view of this hospital, trust me, you can go for any teaching hospital in one of these small countries.
Every major hospital we are rebuilding today, we are getting all of them completely digitalized. Completely. Let me interpret that. What that means is, if you are a patient, you come here, you have a problem, and we need to take you from here to Itumbang. You don't need to buy a card in Itumbang. You don't need, all you need to do is to know your name. Once you mention your name, the medical records office in Itumbang will punch the computer. Every single analysis, all the lab tests they've done for you, all the treatment and the drugs they've given to you in Ikono will appear in Itumbang. And the doctors should be able to treat you.
I know what we've put here. I know what's on ground. I know the quality of equipment that we have here. When we came here to tear the bush to enter, I was wondering. When we saw it, I couldn't believe that this was still called anything near hospital.
What the governor has done is even beyond our expectation. Because when I came from Itumbang in 2014 to meet this hospital, it was in a very state of dilapidation. But now the governor has provided up-to-date equipment and furniture to the whole hospital, including the main theater. As you have seen, this is a new operation table, that's an sitting machine, everything is new, and we are so grateful to the governor, and we appreciate it.
I came for this hospital to come and take medicine for the sickness where I get. So all that, they don't come treat me fine, and the hospital fine. The workers there, everything is there, even the equipment. In those days, it's not been good like this. So everything is, even if you look at all this sitting, everything is good now.
History has been written on gold concerning your love for the Oron people. I stand here, Your Excellency, to recall that in 2015, when you resumed, Oron local government was one of the local government that you visited. And there, you saw what the Oron people were passing through as it related to road construction. And you made a statement. Your Excellency, in few months, we saw what you did. May the Lord bless you. This is your second term, sir. Our nation has been the first that you are stepping your foot into to bless. And today, we are all here as witnesses to see the great change that you have brought to General Hospital Equator Oron.
A wonderful feat for the commissioning of this General Hospital. My younger sister was delivered in this hospital in 1980. And it was, we know how deteriorated this hospital was for a very long time. We know cases of people who have lost their families in this hospital because of the deteriorated state of the hospital. For the governor to have refurbished, renovated, and equipped this hospital, it's a thing of joy for the people of Oron.
This hospital was in a very critical mode. Things were not fixed up properly like this. We didn't have good beds for our patients, but now if you enter each ward, you can see good beds for the patients to lie. You see good mattresses, see good bedspread for the comfort of the patients. I am happy, I'm glad to have him as a governor, even in the next generation.
In transforming the state healthcare system, the governor was resolute in maintaining that no matter how rich a man is, an emergency could occur where access to a standard health facility could be his only chance of survival. A belief that drove him to embark on the complete revamp of secondary health facilities in all the 10 federal constituencies of the state.
Mind those people who are boasting that they can go abroad. There's an emergency, you can find yourself. 15 minutes to be too much for you to survive. So when you hear somebody say, I have so much money to go abroad, he doesn't understand life. I've seen where somebody was on emergency, 10 minutes to determine whether he was alive or he was in the mortuary.
His administration has also embarked on training of health workers and recruited more to meet the yearning needs of the populace.
I've been opportuned to be in this workshop. It's a molecular diagnosis biology workshop, and it has spanned for a course of 3 days. So during my stay here, I've learned about the research aspect and also the practical aspects of the course. As you can see, those are my colleagues, and we are learning the use of PCR. The PCR machine is used to amplify genes for both study and also to analyze results. And I want to say a very big thank you to the government of Akwa Ibom State and also to the Commission of Health for providing us with this opportunity.
I want to thank His Excellency for such an opportunity he has granted the participants on biomolecular training. And just like every other training, it actually aims at building capacity. But this other training also has taken a step further by not just looking at the biomolecular diagnosis that has been aimed at only COVID testing. Now we want to look at the use of biomolecular diagnosis in other levels. So this training is actually here to build capacity, and also since the Udom PCR laboratory is being kicked off, it's going to avail the populace, the Akwa Ibom, the opportunity of having their DNA tests that they've been going out to do outside being done here.
In lieu of these facilities and quality healthcare delivery programs, Akwa Ibom has become a mecca of sorts, with people coming in from all over the country. It really helped during the lockdown because those equipments were already on ground, having been brought in from the best producers globally. It is the readiness and proactive health measures put in place in the state, made possible by a visionary, that has made Akwa Ibom to defy the projections of critics and prevent the disease from reaching a community transmission rate. Thus, it is safe to say that COVID-19 arrived on April 1 to see in Akwa Ibom a state prepared by Governor Udom Emmanuel for any medical emergency.
rising.
Poised to deliver on his promises of job and wealth creation, Governor Udom Emmanuel has consciously set Akwa Ibom on the wings of history.
The Udom Air, first state-owned airline in Africa, welcomes you to the land of limitless opportunities with more than 150 new roads spanning 1,700 kilometers.
Leading to several industries like the King's Flour Mill, Jubilee Syringe Industry, Metering Factory,
Coconut Oil Factory, Plywood Manufacturing Factory, Rice Mill Factories, Fertilizer Blending Factory, Plastic Manufacturing Factory,
Toothpick and Pencil Factories, Paints Factory, Tissue Manufacturing Company, Car Assembly Factory, and lots more on the way.
It's the completion agenda with Governor Udom Emmanuel.
Let's live, invest, and do business in the most peaceful state in Nigeria.
Akwa Ibom is on the wings of history.